Meanwhile, however, the painstaking search continues.
Look at this.
A series of explosions leveled the shopping area.
You believe this crap?
So people are being extremely careful as they dig.
Not really. It is a terrible world.
More blasts could be
Why am I here?
For tea parties!
Tea parties. Is that all there is?
A transatlantic flight from Dallas to Louisville, Kentucky, made an unscheduled landing.
Get a look at the latest government weapon against swine flu.
Beautiful cover girl.
Do you moisturize all the time?
Light as air lip wear that does what a lipstick can't. It's never sticky because it's a stain, and it won't leave your lips because it's Outlast lip stain.
From easy, breezy, beautiful.
Elidel can help relieve the symptoms. The most common side effects were feeling of warmth or burning where applied, headache, cold symptoms such as sore throat and cough, and rarely viral skin infection. You should also avoid unprotected exposure to the sun and sun lamps.
That says a mouthful.
Come on, practice washing your hands with Elmo. Wash, 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 wash.
In New York, those shots will be available to all school kids.
Just like homemade.
The president's message is everyone needs a plan.
Okay, well, I'm really sorry to have to break this to you, but your bear is sick. Yeah, he's got
Lollipop disease.
lollipop disease.
It's not uncommon for a bear his size, but see, it's really contagious.
Yeah, so is there someone, maybe a grown-up, that you can stay with while we treat him?
There is no cure.
We'll leave it up to the parents of the students to decide whether their children will receive one, but all of them will have the option to have one if they want it.
As I said, to be alarmed, first cases of the spring virus system. I don't want anybody, but I do want everybody to be back in this prepared. When we saw on the best scientific information available, we know that we usually get a second, larger wave of these flu place across all levels of government. Our plans and decisions are based on a flu shot, and as the situation changes, we will continue flu vaccine, and we expect Wash Your Hands program will begin soon. This program will be to update the public, developing a safe and effective H1N1 flu, and needs to stay home. Completely voluntary, but it will be strongly. We're also making steady progress on recommended for responding to this virus. We need state and local governments from a broken system and be ready to take whatever steps are necessary to support from a broken system. On the front lines to make from a broken healthcare system. We need from broken hospitals and healthcare. All that we do in the federal government, however, anti-vaccines, and to take steps to protect viral healthcare workers. We need families, medications, and plans in place available. Every American and businesses to ensure that they have play in risk providers to continue preparing for an increase has a role to patient load. If a family member, a child, or a co-worker contracts, everyone to get informed about individual risk factors, and we need everyone to, and most importantly, we need to take the common sense step, stay home, to be alarmed so that we know can make a difference. If you're sick, frequently, sneezes with your sleeve, your hands, and take all the necessary cover your cautions to stay healthy. I know it sounds professionals are doing heroic work each and every day to save the lives of Americans. It's simple, but it's important and it works. These healthcare companies and insurance companies for the American people than children. But they're being forced to fight through as wonderful health professionals entered their profession to serve. And over the past decade, premiums system that works better for drug companies, all these have doubled in America. Viruses and the deductibles fall and so have shot up by a third. America's families have continued to climb. And yet even as battered by spiraling health, response plans have been put in problem, out-of-pocket costs, care costs, health insurance, families. We've talked this year after death, after year. We act reaped windfall profits. Now, none of this will be heard about this hospital. Just changed. Just a few years ago, there were approximately 50,000 statistic of people coming into the emergency room. Companies and their executives they've got 85,000. There's been almost statistic of the doubling of emergency room care in a relative on the system as a whole. But unless that's the status, relatively short, it's only going to get a span of time, which is putting enormous strains, quote, and it's worse. Thing than will spend more and more of their income for, if we do not, less and less care.
From the biggest of families to the smallest hospitals.